I started getting sick. And, all of a sudden, this picture-perfect future that we had planned changed in the blink of an eye.
Martha was having trouble breathing, her back hurt, and she became uncharacteristically fatigued.
Mesothelioma is a very rare type of cancer that develops from a thin layer of tissue covering many of the internal organs of human body. This thin layer of tissue is known as mesothelium. The most commonly affected areas of mesothelioma cancer are the lining of the lungs and the chest wall. The least commonly affected areas of the cancer are the abdomen, and rarely it can be the heart as well.
And so what you see is her heart beating here. You can actually see in real time, and she's breathing.
The signs and symptoms of the cancer cannot be detected on an early stage, but they include shortness of breath, a swollen abdomen, chest wall pain, back pain, feeling tired, weight loss, and cough. The only definitive known cause of mesothelioma is asbestos.
I was born in 1948, so there was asbestos and everything back then.
Asbestos takes 30 to 40 years before it develops the tumor inside your body. I had no idea that I had this ticking time bomb.
Asbestos can be found in various materials, and when asbestos fibers are inhaled or ingested, they may become embedded in the linings of the lungs, abdomen, or heart. Eventually, the fibers can cause inflammation and scarring, resulting in irritation. This irritation will lead to the development of mesothelioma tumors. Any amount of asbestos exposure can cause mesothelioma. The most common materials in which asbestos is found include floor tiles, textiles and composites, textured coatings, asbestos cement products, roofing felt, asbestos insulating boards, sprayed coatings on ceilings, walls, beams and columns, and loose asbestos that can be found in ceiling and floor cavity. As these materials can be used highly in only certain occupations, these occupations may experience higher rate of exposure. Mesothelioma can be caused by three types of asbestos exposure. Firstly, at-risk occupations. Workers may be exposed to asbestos on the job. High-risk occupations include shipyard workers, supervisors, mechanists, and mechanics. Meanwhile, second-hand asbestos exposure is also very common. In this, asbestos may be brought home on workers' hairs, skin, and clothing, exposing loved ones to the fibers. Washing the clothes of a worker can also cause second-hand asbestos exposure. Finally, the category of veterans at risk of developing mesothelioma comes along. Asbestos is widely used throughout the military, exposing Navy, Army, and Air Force veterans, among others, to development of mesothelioma. More than 80% of mesothelioma cases are caused by exposure to asbestos. The greater the exposure, the greater the risk. Next on the list of locations is pericardial mesothelioma. Taken from its name, cardiac heart tumors are very rare. Pericardial mesothelioma is an extremely rare type of cancer that is formed in the lining of the heart. The lining of the heart is known as pericardium. Although these tumors are rare, when they do occur, it is often a result of metastasis from cancer elsewhere in the body. However, pericardial mesothelioma has not been widely linked to the metastasis of cancer in other parts of the body. In the case of pericardial mesothelioma, there is anecdotal evidence of other conditions, such as pleural edema, masking the cancer. The research on life expectancy and most effective treatment is yet to develop because the cases are very rare.
When I found out, I thought it was like the end of the world because my dad has such a big impact on me for my whole entire life. He taught me how to hunt, he always takes me hunting. I just thought
fewer than 200 cases of pericardial mesothelioma have been reported yet. So what are the causing factors of pericardial mesothelioma? Potential pericardial mesothelioma risk factors include radiation exposure, tuberculosis, erunite exposure, thoratrast, simian virus 40 infection, and lastly, of course, asbestos exposure. Pericardial mesothelioma has been linked to asbestos exposure very highly. Other forms of mesothelioma such as peritoneal and pleural mesothelioma are also caused by asbestos fibers. Since it takes quite a bit of time to develop mesothelioma cancer, inability to detect asbestos exposure can make identifying the cause of pericardial mesothelioma cases very difficult. The symptoms of pericardial mesothelioma are often related to the heart muscle and can be very vague. Symptoms may also take many years to appear. In some cases, the symptoms are never even diagnosed, and in these sort of instances, pericardial mesothelioma may not be diagnosed until autopsy. There are a list of mesothelioma symptoms in pericardial section, and possible pericardial mesothelioma symptoms include chest pain, right shoulder pain, fatigue, cardiac tamponade, dry cough, pericardial effusion, pericardial thickening, chest pain, cardiac tamponade, cardiomyopathy, right shoulder pain, shortness of breath, difficulty in swallowing, and swelling of the legs or lower extremities. Pericardial mesothelioma symptoms are vague and easily attributed to many other conditions. This is why a difficult diagnostic process and the potential for misdiagnosis is highly present. Coming to the diagnosis, one can ask, How is pericardial mesothelioma diagnosed? Malignant pericardial mesothelioma can be diagnosed with a combination of methods including echocardiogram, PET scan, CT scan, cytology, MRI, CT guided liquid biopsy, histology, X-ray, immunohistochemistry. Imaging tests may identify fluid around the heart and any visible pericardial tumors. However, procedures such as echocardiography can only distinguish fluid buildup, and it cannot confirm, unfortunately, the cause of the fluid buildup as mesothelioma. Meanwhile, biopsies are an important step for an accurate diagnosis. In this procedure, a tissue sample from the affected area is analyzed under a microscope. A biopsy can determine cell type and help us understand the stage of mesothelioma. An accurate mesothelioma diagnosis is very important for pericardial mesothelioma. Worsening symptoms can have a severe impact on the body as these diseases progress. As a result of the disease rarity and challenging diagnostic process, many pericardial mesothelioma patients aren't diagnosed until autopsy. Unfortunately, only about 10 to 25% of pericardial mesothelioma cases are diagnosed before a patient's death. There are certain potential misdiagnoses of pericardial mesothelioma, which include heart disease, heart failure, tuberculosis, various forms of pericarditis, inflammation of the tissue surrounding the heart, etc., cardiomyopathy, which is a heart muscle disease, and atrial myxoma. Misdiagnosis can lead to ineffective treatments and wasted time. To prevent misdiagnosis, patients may want to seek a second opinion to confirm their diagnosis.
Guy who did the thoracentesis, he was a pulmonologist. He sat us down and he's like, you have 3 options.
What further is the pericardial mesothelioma treatment procedure? Pericardial mesothelioma may be treated with standard mesothelioma treatments such as surgery and chemotherapy. Treatment options may vary based on disease stage, patient age, overall patient health, and symptom severity. Treatment options for pericardial mesothelioma include radiation, surgical removal of tumors, chemotherapy, which includes anti-cancer drugs, most often platinum-based. These include cisplatin or carboplatin and pemetrexed. It also includes pericardial window, which is the draining of excess fluids by cutting a hole in the pericardium.
Called a radical pleurectomy, where instead of taking the lung out, they do a meticulous dissection.
Other than that, it includes pericardiectomy, which is the full or partial removal of the heart lining. pericardiocentesis, which is the draining of excess fluid around the heart with a needle.
Well, the cancer, it's come back, and I finished 6 rounds of chemotherapy over about 4 months.
Treatment plans depend largely on the stage of the disease and the aim of the treatment. Sadly, currently there are no curative options for this disease. But most researchers include and urge a multimodal approach to the treatment. Multimodal treatment plans combine 2 or more therapy types. For pericardial mesothelioma, patients treated with surgery and chemotherapy have had the best results. However, surgical tumor removal and chemotherapy may maximize mesothelioma patients' life expectancy. For late-stage diagnosis, treatment may be limited to palliative options. Palliative treatments aim to reduce symptoms and improve patient quality of life. The prognosis for pericardial mesothelioma is generally very poor. The life expectancy for peritoneal mesothelioma patients is about 6 months. However, some patients have lived much longer. Researchers compared the survival periods of patients who received a single treatment versus those with multimodal treatment. Those with a single form had a median survival of 4 to 5 months versus 16 months for the multimodal patients. The rarity of pericardial mesothelioma poses a problem for researchers. For instance, clinical trials for pericardial mesothelioma are difficult to execute because there are such few and rare cases. Pericardial mesothelioma is very rare. However, patients diagnosed with a heart cancer should discuss their case with a mesothelioma specialist to determine their options.
That's right, yeah. I was diagnosed with non-Hodgkin's lymphoma in May 2015. I went on to have 6 months of chemo, which put it into remission.
Finally comes in the types of mesothelioma cancers, the end stage. In severe cases of the disease, the following signs and symptoms may be present, such as the blood clots in the vein, which may cause thrombophlebitis, disseminated intravascular coagulation, which is basically a disorder causing severe bleeding in many body organs, jaundice or yellowing of the eyes and skin, low blood sugar, pleural effusion, and pulmonary embolism, which is the blood clots in the arteries of the lungs. If a mesothelioma forms metastasis, these most commonly involve the liver, adrenal gland, kidney, and other lungs. Diagnosis. Diagnosis of mesothelioma can be suspected with imaging, but is confirmed with biopsy. It must be clinically and histologically differentiated from other pleural and pulmonary malignancies, including reactive pleural disease, primary lung carcinoma, pleural metastasis of other cancer and other primary pleural cancers. Primary pericardial mesothelioma is often diagnosed after it has metastasized to lymph nodes of the lungs. Here, imaging comes in play. Diagnosing mesothelioma is often difficult because the symptoms are similar to those of a number of conditions. Diagnosis begins with a review of the patient's medical history, a history of exposure to asbestos may increase clinical suspicion for mesothelioma. A physical examination is performed, followed by chest X-ray and often lung function tests. The X-ray may reveal pleural thickening commonly seen after asbestos exposure and increases suspicion of mesothelioma. A CT scan or an MRI is usually performed to confirm this stage. If a large amount of fluid is present, abnormal cells may be detected by cytopathology if this fluid is aspirated with a syringe. For pleural fluid, this is done by thoracentesis or tube thoracostomy, which is chest tube. For ascites with paracentesis or ascitic drain, and for pericardial effusion with pericardiocentesis. While absence of malignant cells on cytology does not completely exclude mesothelioma, it makes it much more unlikely, especially if an alternative diagnosis can be made. For example, heart failure and tuberculosis. However, with primary pericardial mesothelioma, pericardial fluid may not contain malignant cells and a tissue biopsy is more useful in diagnosis. Using conventional cytology, diagnosis of malignant mesothelioma is very difficult. But the enhancement of accuracy of cytology has been made by immunohistochemistry. Coming to the biopsy of the method, generally a biopsy is needed to confirm a diagnosis of malignant mesothelioma. A doctor removes a sample of tissue for examination under a microscope by a pathologist. A biopsy may be done in different ways, depending on where the abnormal area is located. If the cancer is in the chest, the doctor may perform a thoracoscopy. In this procedure, the doctor makes a small cut through the chest wall and puts a thin lighted tube called a thoracoscope into the chest between two ribs. Thoracoscopy allows the doctor to look inside the chest and obtain tissue samples. Alternatively, the cardiothoracic surgeon might directly open the chest, thoracotomy. Alternatively, the cardiothoracic surgeon might make use of thoracotomy, which is the direct opening of the chest. If the cancer is in the abdomen, the doctor may perform a laparoscopy. To obtain tissue for examination, the doctor makes a small incision in the abdomen and inserts a special instrument into the abdominal cavity. If these procedures do not yield enough tissue, an open surgical procedure may be necessary. High results are even obtained by immunochemistry. Immunohistochemical studies play an important role for the pathologist in differentiating malignant mesothelioma from neoplastic mimics, such as breast or lung cancer, that has metastasized to the pleura. There are numerous tests and panels available, but no single test is perfect for distinguishing mesothelioma from carcinoma or even benign versus malignant. The positive markers indicate that mesothelioma is present. If other markers are positive, it may indicate another type of cancer, such as breast or lung adenocarcinoma. Saltaronin is a particularly important marker in distinguishing mesothelioma from metastatic breast or lung cancer. Subtypes of malignant mesothelioma. There are three main histological subtypes of malignant mesothelioma. First is epithelioid, second is sarcomatous, and third is biphasic. Epithelioid and biphasic mesothelioma make up approximately 75 to 95% of mesothelioma and have been well characterized histologically, whereas sarcomatous mesothelioma has not been studied as much highly. Most mesothelioma express high levels of cytokeratin 5, regardless of subtype. Epithelioid mesothelioma is characterized by high levels of salretinin. Sarcomatous mesothelioma does not express high level of salretinin. Other morphological subtypes have been described as clear cell, glandular, desmoplastic, deciduous, adenomatoid, mucohyaline, cartilaginous, and osseous metaplasia. Differential diagnoses include pleural sarcoma, synovial sarcoma, thymoma, metastatic clear cell renal cell carcinoma, metastatic osteosarcoma, metastatic adenocarcinoma. Staging of mesothelioma is based on the recommendation by the International Mesothelioma Interest Group. T&M classification of the primary tumor, lymph-node involvement, and distant metastasis is performed. Mesothelioma is staged IV4. Mesothelioma is staged 1A to 4 based on the T&M status. The prevention of mesothelioma includes Mesothelioma can be prevented in most cases by preventing exposure to asbestos. The recommendation of exposure limit of asbestos is 0.1 fiber per cubic meter. Diagnosis may also include screening. There is no universally agreed protocol for screening people who have been exposed to asbestos. Screening tests might diagnose mesothelioma earlier than conventional methods, thus improving the survival prospects for patients. The serum osteopontin level might be useful in screening asbestos-exposed people for mesothelioma. The level of soluble mesothelin-related protein is elevated in the serum of about 75% of patients at diagnosis, and it has been suggested that it may be useful for screening. For treatment purposes, mesothelioma is generally resistant to radiation and chemotherapy treatment. Long-term survival and cures are exceedingly rare. Treatment of malignant mesothelioma at earlier stages has a better prognosis. Clinical behavior of the malignancy is affected by several factors, including the continuous mesothelial surface of the pleural cavity, which favors local metastasis via exfoliated cells. Invasion to underlying tissue and other organs within the pleural cavity, and the extremely long latency period between asbestos exposure and development of the disease. The histological subtype and the patient's age and health status also help predict prognosis. The epithelioid histology responds better to treatment and has a survival advantage of sarcomatoid histology. The effectiveness of radiotherapy compared to chemotherapy or surgery for malignant pleural mesothelioma is not known. Treatment by surgery by itself has proved disappointing. In one large series, the median survival with surgery was only 11 months. A pleurectomy decortication is the most common surgery for mesothelioma cancer, in which the lining of the chest is removed. Less common is an extrapleural pneumonectomy (EPP), in which the lung, lining of the inside of the chest, the hemidiaphragm, and the pericardium are removed. In localized pericardial mesothelioma, pericardectomy can be curative. When the tumor has metastasized, pericardectomy is a palliative care option. It is often not possible to remove the entire tumor. Treatment can also be caused by radiation. For patients with localized disease and who can tolerate a radical surgery, radiation can be given post-operatively as a consolidative treatment. The entire hemithorax is treated with radiation therapy, often given simultaneously with chemotherapy. Delivering radiation and chemotherapy after a radical surgery has led to extended life expectancy in selected patient populations. It can also induce severe side effects, including fatal pneumonitis. As part of a curative approach to mesothelioma, radiotherapy is commonly applied to the sites of chest drain insertions in order to prevent growth of the tumor along the track of the chest wall. Although mesothelioma is generally resistant to curative treatment with radiotherapy alone, palliative treatment regimens are sometimes used to relieve symptoms arising from tumor growth, such as obstruction of a major blood vessel, radiation therapy. When given alone with curative intent, has never been shown to improve survival from mesothelioma. The necessary radiation dose to treat mesothelioma that has not been surgically removed would be beyond human tolerance. Radiotherapy is of some use in pericardial mesothelioma, but in others it has been proved to be a bit disappointing. Chemotherapy is the only treatment for mesothelioma that has been proven to improve survival in randomized and controlled trials. Cisplatin in combination with raltetrext has shown an improvement in survival, similar to that reported from permitrext, in combination with cisplatin. But raltetrext is no longer commercially available for this indication. For patients unable to tolerate permitrext, cisplatin in combination with gemcitabine or vinorelbine is an alternative. Or vinorelbine on its own, although a survival benefit has not been shown for these drugs. For patients in whom cisplatin cannot be used, carboplatin can be substituted, but not randomized data have shown lower response rates and higher response rates of hematological toxicity for carboplatin-based combinations, albeit with similar survival figures to patients receiving cisplatin. In pericardial mesothelioma, chemotherapy, typically adrimycin or cisplatin, is primarily used to shrink the tumor and is not curative. Treatment by immunotherapy is also extremely common. Treatment regimens involving immunotherapy have yielded variable results. For example, intrapleural inoculation of Bacillus calmette (BCG) is an attempt to boost the immune response, was found to be of no benefit to the patient, while it may be benefit of patients with bladder cancer. Mesothelioma cells proved susceptible to vitrolysis by LAK cells following activation by IL-2, but patients undergoing this particular therapy experience major side effects. Indeed, this trial was suspended in view of the unacceptably high levels of IL-2 toxicity and the severity of side effects, such as fever and cachexia. Nonetheless, other trials involving interferon-alpha have proved more encouraging, with 20% of more patients experiencing a greater than 50% reduction in tumor mass combined with minimal side effects. Mesothelioma, since caused by a very harmful material, can go through legal issues. Some people who were exposed to asbestos have collected damages for an asbestos-related disease, including mesothelioma. Compensation via asbestos funds or class action lawsuits is an important issue in law practices regarding mesothelioma. There have been several cases amounting to billions of dollars from the asbestos funds that have been compensated for mesothelioma cancer. Both in America and in UK, mesothelioma cancer compensation is available to many court cases. The studying of mesothelioma can also be further classified into stage 4 mesothelioma, which involves the cancer spreading into distant tissues, organs, and lymph nodes. This is the most advanced and further gone stage. Treatments aim to improve survival and quality of life at this stage, but patients typically have a life expectancy of about 1 year. This classification comes under the classification of mesothelioma stages. Mesothelioma is categorized into 4 stages: Stage 1 and Stage 2 are considered the early stages of mesothelioma. Meanwhile, Stage 3 and Stage 4 are considered the late stages. Patients with late stage diagnosis typically have shorter life expectancy than those diagnosed earlier. Clinical trials may also be available to late stage patients and should be discussed with their doctors. Trials offer emerging therapies to patients in various stages. Doctors may suggest these treatments for stage 4 mesothelioma patients depending on each case. However, patients diagnosed with end-stage mesothelioma may seek treatment for supportive care, which is often referred to as palliative care. Palliative treatments may provide symptom management and increase survival times and comfort levels. Stage 4 mesothelioma symptoms may be very severe. These symptoms may come about from the cancer spreading to other parts of the body, including other organs. Stage 4 mesothelioma symptoms include fatigue, fever, unexplained weight loss, chest pain, back pain, abdominal pain, difficulty in breathing, difficulty in swallowing, and night sweats. They may also include peritoneal effusion and pleural effusion. Patients that may undergo palliative treatments to reduce discomfort caused by symptoms. Common palliative options include removing fluid buildup through surgical procedures. Fluid accumulation is often the cause of breathing difficulty. Stage 4 mesothelioma by type. Mesothelioma cancer staging protocols are different based on the type of mesothelioma a patient has. Cancer location and metastasis also vary by mesothelioma type. Doctor will use staging and type to better understand a patient's prognosis. Stage 4 mesothelioma by type includes pleural mesothelioma.
I have pleural mesothelioma in my left lung, which I had major surgery for.
Pleural mesothelioma is, of course, again the most common type of cancer and has the most documented cases. Pleural mesothelioma staging systems include the Bouchard system, the Brigham staging system, and the T&M system. The defining characteristic of stage 4 pleural mesothelioma is distant metastasis. Spreading may occur in the bones, lining of the abdomen, peritoneum, liver, lung on the other side of the body, and nearby lymph nodes. The 2-year survival rate for stage 4 pleural mesothelioma is about 24%. Stage 4 peritoneal mesothelioma. There is no staging system for peritoneal mesothelioma. However, many mesothelioma specialists use the Peritoneal Cancer Index (PCI) to stage this type. Other forms of abdominal cancer also use this staging system. This system divides the abdomen into 9 distinct areas. Each area is scored based on the size of the tumors in that area. Scores are added to determine the stage. Stage 4 peritoneal mesothelioma has PCI score of 31 to 39. At this stage, tumors have spread outside the immediate area of the peritoneum. Spreading may occur in the chest wall, lymph nodes throughout the abdominal cavity, and other distant tissues and organs. Further, there is stage 4 pericardial mesothelioma. Like peritoneal mesothelioma, there is no formal staging system for pericardial mesothelioma. Doctors use general cancer staging guidelines to determine the stage at diagnosis. Due to its rarity, the disease is almost never detected before it enters the late stages. This particular form of the cancer is often diagnosed posthumously. Stage 4 pericardial mesothelioma may spread to the abdomen, esophagus, chest cavity, other organs and tissues outside the pericardium, which is the heart lining. Compared to the other stages of disease, stage 4 mesothelioma has the least favorable mesothelioma prognosis and shortest average life expectancy. The extent of distant spreading and a decline in patient health limit and treatment option which may impact prognosis. In addition to mesothelioma staging, other factors can impact patient outcomes. The factors influencing stage 4 mesothelioma prognosis include the tumor location. Patients with stage 4 pleural or peritoneal mesothelioma often have longer life expectancies than those with other forms of the disease. The influencing factors can also include the cell type. Stage 4 epithelioid mesothelioma typically has a more favorable life expectancy than sarcomatoid or biphasic mesothelioma. The other factors include patient age and overall health. Young patients with stage 4 mesothelioma typically have a better outcome than older patients diagnosed with this age. This may be because of their stronger immune system. Poor overall health and pre-existing conditions like diabetes and chronic obstructive pulmonary disease (COPD) may decrease life expectancy. On average, survival rates for stage 4 mesothelioma are lower than the earlier stages. Survival rate is the percentage of patients with the same type and stage of disease who survive for a given period of time. Although survival rates are typically low for stage 4 mesothelioma, each case is different. Patients should discuss their chance of survival with their doctors.
I looked over to the bed and I could see his face. He was all pink and he looked peaceful. And then I noticed that I didn't hear any breathing sounds.
And then all of a sudden one day, that time bomb went off.
The question arises, can stage 4 mesothelioma be cured? And the answer to it is, there is no cure for mesothelioma. Late-stage mesothelioma patients typically have a lower chance of long-term survival than those diagnosed earlier. However, patients may extend life expectancy by receiving treatment. Studies and clinical trials are continuously testing emerging treatment opportunities for late-stage mesothelioma patients.
Sandra was diagnosed with mesothelioma back in 2017, and she's very kindly agreed to speak to us today.
There are, though, many survivors of mesothelioma stage 4. Although rare, it is possible for stage 4 patients to live beyond their general and initial prognosis.
I started experiencing some chest pain and shortness of breath. And the pain got worse, so I ended up seeing the physician, and I kept telling him about the history of mesothelioma.
One of the most commonly known is Quincy Jones, a well-known comedian who was diagnosed with stage 4 peritoneal mesothelioma in 2016. Diagnosis, he only had 1 year to live. But Quincy has been living with mesothelioma for 4 years. Questions that patients ask doctors, there is a common one of, can you survive stage 4 mesothelioma without treatment? Mesothelioma life expectancy without treatment is shorter than average life expectancy with treatment. Treatment can affect how long a mesothelioma patient lives after their diagnosis. Regardless of stage, patients who do not undergo mesothelioma treatment have life expectancy of around 6 months. Stage 4 pleural mesothelioma patients who undergo treatment have a median survival of 12 months. Patients should discuss their treatment options with their doctors, specialists, and families. Coping with a stage 4 mesothelioma diagnosis can be very difficult, but is very important. Diagnosis during the final stage of mesothelioma is difficult for the patient and their loved ones. Coping with a cancer diagnosis is a personal journey, but there are resources that may make difficult decisions easier. Connecting with a mesothelioma community can help a lot.
It just benefits all of us in society when we support organizations.
And learning to stay healthy as a caregiver can also be a great opportunity for mesothelioma patients' resources.
Quiet warrior, I guess. He was just always positive, like he's just gonna make it through this.
But 2007, I started feeling really good. And that's when we decided that Lung Waving Day was going to be a holiday.
And so many times people say, you guys are so positive, and we're like, it won't be the end till the end.
A stage 4 diagnosis is daunting, but there are options available to patients.
They had funding for 25 patients in the SMART program. I was going to be number 15.
My job is really to help people through the different stages that the emotional response to people who have a diagnosis of mesothelioma and their families. Very many people enter this crazy world not feeling like they're very brave, or that they can cope with this, or that really all of these steps would be possible, and they come out of it, they come out of active treatment saying, wow, you know, I really did learn to cope with that, and I am feeling like I have so many more tools to face whatever is going to be next. Sometimes though, symptoms like anxiety or depression or fear overwhelm a certain stage, overwhelm a person during a certain stage, or a family member during a certain stage. And that's where I come in, to really help people step back and to start to reinforce some of the ways in which we can cope through things that we absolutely feel like there's no way that we could cope. So resilience gets a lot of, you know, how resilient, my family member's not resilient enough, they're not coping enough. People worry about, how am I going to do this? Will I fall apart? How can I get from here to there? So resilience, I like to say what resilience isn't. Resilience isn't just being brave and buckling down and getting right through it. people who are resilient have an awful lot of trouble at different stages with anxiety. They feel that this is too stressful, overwhelmingly stressful, especially at pivotal moments like at the time of diagnosis, that they're overwhelmed. But that can be a very normal part of gearing up for the next step. Anxiety, sadness, depression, can be all very normal part of the cancer experience and not something that we should be afraid of. Resilient people can be worriers. They can worry a lot about, will the cancer recur once active treatment is done? Will my energy ever return? I don't feel like I'm the same person. My relationship with God sometimes is changing and faltering, and I don't feel the same. Will I ever get that back? That was a big consolation in my life prior to this. Will my partner and I ever get back to normal? Will my friends ever understand me? Will I always feel like a foreigner in my peer group?
Did is they went in, they removed the 8th rib or 6th rib down, and then they open you up. It's called an extrapleural pneumonectomy. Then he went in, removed the entire left lung, the pleura, the lining around my heart, and the left half of my diaphragm. So I removed everything in the left half of my chest cavity. And then during the surgery, they do an intraoperative heated chemo. So they heat the chemotherapy up to 140, pump it into the chest cavity, shake and bake, wash it around for an hour, and then wash it back out, and then sew everything up.
Powerful radiation first, followed by removal of a lung, the complete lung, followed by chemo within the next 6 months after that, which they hoped would essentially minimize recurrences.
So our idea is to treat this as a chronic disease. So what we do is we use surgery to get rid of all the tumor that we can see. And we use the other things like radiation, immunotherapy, and cryoablation to keep it that way, just like we do with the other chronic diseases, so people can live a long time with the disease. Despite the fact that they have it, they can still live good quality of life.
And he told me about Dr. Sugarbaker. He goes, you're young, you're healthy, you've got this new daughter to live for. He goes, I would go to Dr. Sugarbaker. And so my husband, without missing a beat, said, get us to him. And 12 days later, that's where we were, was seeing Dr. Sugarbaker.
Martha's doctors referred her to Dr. Robert Cameron, who has pioneered a comprehensive, highly successful mesothelioma treatment program at UCLA.
Surgery is actually the most reliable treatment because in our hands at UCLA, about 90% of the time we can remove all the tumor that we can see during surgery, and that's the goal, is to remove all the tumor that we can see. We can take it off the lung and leave the lung in place.
But today, 6 years after her initial diagnosis, Martha is cancer-free.
It is what you call a miracle, because we were not expecting this.
We are a very close family, and with God's help and Dr. Cameron's help, I can have a healthy, longer life.
Thank you so much. You've very eloquently explained what you've been going through since 2017 and more recently, and I'm sure it resonates with a lot of people listening. Thank you so much for your time, and if it's not too early, I'd like to wish you a Merry Christmas.
Oh, same to you. Thank you.
Thank you very much, Sandra. Thank you. Bye-bye.
Thank you. Bye.
Bye-bye.
Bye.
He was just like he was asleep. He just went peacefully.
To learn in more detail about mesothelioma, Subscribe to our channel. If you found this video beneficial and helpful, leave a like. And if you have any questions to ask our experts, you can leave a comment below.